Medicare Advantage Plans. Now, prior to 2003, Medicare Advantage plans were called Medicare Choice Plans because you had a choice. You could choose to get your Medicare through the federal government, or you could choose to get your Medicare through a private health insurance company. Now, today, they're called Medicare Advantage Plans, and Medicare will actually pay a private health insurance company of your choice to manage your Medicare. Now, that is why most Medicare Advantage companies can offer plans at low monthly premiums, and in many cases, no premium at all, because the majority of the premium is paid by Medicare taxes and premiums that you pay Medicare themselves. Now, in a Medicare Advantage plan, you have a choice. You can choose to get your A and B Medicare through Medicare themselves, or you can choose to get your A and B Medicare through the private health insurance company. And if you make the decision to get your Medicare through a private health insurance company, there will be several advantages that you will receive in return, like vision and dental and health and wellness programs, fitness, transportation, all kinds of extra things that Medicare doesn't cover themselves. And Medicare Advantage plans, most of them also cover Medicare Part D. They will give you predictable co-payments, defined amounts instead of based on a percentage, and they will limit your out-of-pocket expenses for the year, something Medicare also doesn't do. And they'll get into the coordination of your care and preventative care. Their goal is to help manage your care and make you healthier than when they found you. So some of the algebra on this looks like this. A plus B, and in most cases Part D, plus many advantages equals Medicare Part C, which is called an Advantage plan, also managed by a private health insurance company. And there are thousands and thousands of options to choose from nationwide. That is one of the advantages of an Advantage plan, is you have a choice between insurance companies and they compete for your business. And that's different than just traditional Medicare that offers you just one single choice. Now, because there's thousands of options nationwide, Medicare must get involved in the regulation of private insurance companies. And so they created a Medicare Advantage plan star rating system, which means they rate plans based on their performance. 1 star would be poor, 5 stars would be excellent. And if you want to know more about Medicare star ratings, you can check out our video called Star Ratings to find out more about how star ratings work and what they are actually rating. So with the Medicare Advantage plan, because there's thousands of options to choose from, those private insurance companies do want to limit what doctors and providers you can see. Now, that's one of the disadvantages of an Advantage plan, is that you're going to be limited to certain doctors and hospitals. But there's different flavors of those limitations. For instance, you'll need to know the difference between an HMO and a PPO, and there's many variations in between. The ones you should be most concerned with are the HMO and the PPO, and this really speaks to the limitation of the network of providers. Now, let's look at the HMO. With an HMO, that stands for Health Maintenance Organization, you must use the doctors that are in their network. And if you go to a doctor outside of their network, the insurance company is not going to pay anything for that out-of-network provider. It is very, very restrictive. However, some HMO networks are so big, you won't have a problem finding your doctor being in their network. But it's just something you should take precaution with. You may want to look at a different type of network-based plan called a PPO. Now, this is called a Preferred Provider Organization. Now, you have a little bit more freedom with a PPO. You can actually go out of network in a PPO. However, it normally comes at a higher cost to you. And sometimes that higher cost is even more than what Medicare would end up charging. So just be careful with a PPO. The goal is normally to find a HMO that has your doctors in it, but some networks aren't big enough to do that, then you would refer to a PPO. Now, in both cases, whether HMO or PPO, emergency room visits and urgent cares come with worldwide coverage. Medicare only works in the United States, so yet another advantage. Now, there's some qualifications you'll have to meet to be able to qualify for an Advantage plan. The first one is you're going to have to live in the service area where a Advantage plan is offered. The second qualification is you have to have A and B Medicare. You have to have both. And you must have a valid enrollment period. You just can't get in and out of Advantage plans anytime during the year. There's many different enrollment periods. But if you have an enrollment period, you live in the service area, and you have A and B Medicare, your application will be approved. And best of all, there is no medical underwriting with Medicare Advantage plans, so regardless of your health, you'll actually get enrolled into the plan. Now, in a Medicare Advantage plan, you don't even use your Medicare card. You use the insurance card that comes from the insurance company. Now, you just put your Medicare card away in a safe place because now your private insurance company is paying your claims. Medicare isn't. So this is the card that you will show your doctors, your hospitals, the pharmacy, so on and so forth. Now, before you make your mind up on whether you should enroll in a Medicare Advantage plan, you must understand that there are pros and there are cons to staying with traditional Medicare, and there are pros and cons with a Medicare Advantage plan. And you must weigh those out carefully to make sure that a Medicare Advantage plan is the right fit for you. One of the best ways to do that is through a Medicare insurance broker. Now, make sure you're not dealing with Medicare insurance agents that are captive, meaning they only work for one company, because brokers work for multiple insurance companies, and you don't want to limit yourself to just one type of plan. So a broker is one of the best ways that you can do that.